Oh, keep checking them in. That's why we're here. We are here today to talk about how Kentucky's young people who have played such a role in protecting Kentucky citizens can also play a role in fully and finally defeating this pandemic. After 15 months marked by pain, loss, and sacrifice, the safe and effective COVID-19 vaccines have turned the tide. First, we prioritized our frontline healthcare workers and our most vulnerable citizens. This almost immediately stopped the spikes in deaths we were seeing in our long-term care facilities, protecting our grandparents, our great-grandparents. Then, we were the first state in the entire country to prioritize our educators, to make sure that we could not only reopen but safely reopen our schools, and that each and every educator that was here to serve our students would be fully protected. By the grace of God, and it is the grace of God, these vaccines have proven more effective than we ever could have imagined, virtually eliminating death and serious illness for those who take it, and now even reducing the spread of the virus. What they mean is now everyone who's eligible has a choice to protect them, a choice to protect their family members, a choice to not spread this virus because they're willing to take that shot of hope. They have proven to be so effective that last week the CDC, a little bit abruptly, gave us the green light for vaccinated Americans to return to much of our normal lives. We have adopted the CDC's guidance here in Kentucky, and last week I announced that almost all the restrictions that we've put in place to keep people safe, and they have kept people safe, will expire at the latest by June the 11th. But the real fight is now with our young people, including high school students. Since March, 16 and 17-year-olds have been eligible for the Pfizer shot. Last Wednesday, that age group eligibility dropped to include everyone 12 years old and older. We need every eligible student and the parents and guardians of every eligible student to understand these vaccines are truly safe. They are effective. They protect our young people and their relatives, and they are the key to having a fully normal school year in the fall, something I know that everybody is looking forward to, including this dad of a 10 and 11-year-old. And on a personal note, my son is going to turn 12 in June, and I'm personally going to take him to get this vaccine because I believe it is that safe and that effective. I wouldn't ask any of our young people here today to take it if I wasn't willing to give the same advice to my own children. Let me be very clear. When June 11 hits, those that are fully vaccinated, you're going to be really safe. These vaccines are that great. The risks associated with them are minute and tiny compared to the protection that they provide versus a very serious and a very deadly virus. Like us slightly older folks, most young people experience little more than arm soreness and some fatigue after receiving a dose. And like us somewhat older folks, once vaccinated, young people are almost completely immune from getting COVID. The earliest studies have suggested it is almost 100% effective, and as your teachers would tell you, 100% is the very best you can do. There's no extra credit in vaccines. While it's well established that COVID doesn't pose as great of a threat to young people, these new strains that are out there have changed that calculus a bit. Yesterday, in our COVID press conference, for the first time that I could remember, the highest incident rate was in Kentuckians 10 to 19 years old. What that means is the mainly B117 UK strain is infecting younger individuals, but what it also means is older individuals are not getting the virus because they are vaccinated. It shows both the need for vaccination and the true effectiveness of getting vaccinated. And we've seen some young folks with COVID struggle with long-term implications that we still don't understand all of them. issues with heart and lungs. We call them long-haul cases because some of the symptoms seem to linger. So getting vaccinated is important. It's important for our young people to protect their health. It's important for them to protect their family. It's important for them so in the fall we can have that fully normal school year. And it's also important because we need your help. How often do we, as a society, as a Commonwealth, come to our young people and say, we need you. We need your help to win something. We need your help to protect people. We need your help to overcome a challenge that we adults can't do on our own. But you know, that's what we've been doing since March 6th of 2020. Our kids have sacrificed a lot. I've sat with my son and daughter on their computer when they were learning that way. It was a lot of difficulty, sometimes a little bit of shouting, oftentimes me wondering how much math I had forgotten. Our young people sacrificed their opportunities, sacrificed their normalcy, but each and every one of you are heroes. I couldn't say between 12 and 18 years old that I'd saved anybody's life. But every single one of our young people that sacrificed here in Kentucky have already done that, and those lives are countless. Yes, you gave up opportunity, but there are people walking this earth today because you were willing to do it. That is something truly special, and I think is going to make your generation so powerful and so important going forward. I think you're going to have, yes, the drive and the opportunities, but you're also going to have a level of compassion and understanding, interconnectedness that maybe no generation before you has had. And I am really grateful for everything that you all have done. But we need to ask for just a little bit more. We need our 12 to 18-year-olds, and for that matter, our 18 to 30-year-olds, to step up and to continue to be the heroes that you have been during this pandemic. Isn't it going to be interesting when we look back on this, and that's going to be really soon, when we can look back on this, that everybody played a part. That we never looked at anybody and said, you're too young to help, because I remember getting that all the time. It's going to be where we asked every single person to stand up, and everybody had a part in securing our victory. I can't tell you how much I look forward to June 11th. It has been a long 15 months, and it's going to be really exciting to get life really close to fully back to normal. But for us to be as safe as we can on that date, we need everybody out there to get vaccinated, absolutely everybody. So today I want to thank the students that are willing to step up and do this publicly. You set a great example. Your peers are going to see you willing to do it. And whether or not you ever have a conversation with somebody, I guarantee you there are people that will get vaccinated and will be protected because of the example you're setting. You are truly leading. And for that, the entire Commonwealth says thank you. And let's remember why we need to get these. You know, our present is tough. Our immediate past is tragic. We've lost 6,600 Kentuckians. I can't tell you, I never expected to be a governor that had to report on the deaths of 6,600 people that we care so much about. Each one special, irreplaceable, a child of God. But the great thing is we don't have to lose one more person. Just 15 months into this pandemic, we have the tools and the choice to stop all of that loss in its tracks and to get back to normal. But as we go back to being normal, I hope that we take some of what we've learned in this pandemic with us. And beforehand, I think we thought that we were all disconnected, people looking down at their phones. But guess what? We learned that every choice we make can impact those around us. As a Commonwealth, we sacrifice for one another every single day with every decision we made. So if we can take just a little bit of that compassion and pay it forward, I think the sky's the limit. Let me leave our young adults some good news today. While our immediate past has been tragic, while our present is tough, our future and your future is really bright. We see more economic activity. We see more possibility moving forward than ever in my lifetime. a chance to create the type of jobs in Kentucky that we've only dreamed about, Mayor, in the past, and they're going to be there available for you all. So I'll make my pledge today with all the sacrifice that you've made. I'm going to work, I know the mayor's going to work, and we're all going to work to make sure the possibilities in front of you here in Kentucky are as bright as they've ever been. So thank you, and with that, let me introduce a great mayor who has been a wonderful partner. We have weekly phone calls. We have fought this battle together. She has done a wonderful job for Fayette County. It's why Fayette County is near the top of all counties in vaccinations. We're trying to be a little competitive, so we'll continue to push. But I can't tell you how many lives her leadership has saved. That's Mayor Linda Gordon.
Thank you so much, Governor Beshear. We have been in it together, haven't we? For a long time now. And, you know, this is, I understand this is the last day of school for you all, right? And it has been a strange year. Thank you.
Well, full service
I'm not,
governor.
you know, there's an average height, and I kind of bring it down, right? It's been a strange year, hasn't it? And today is an opportunity to remind any student, as the governor said, 12 years or older, with their families, everyone, to celebrate the end of school by getting a vaccine. And this is the best way. The governor said it, I've said it. This is the best tool we have to get through this and end it. I'm so proud of Lexington. We have had sort of a friendly little competition, and that's good.
It is very good.
And here in Lexington, we have fully vaccinated 150,000 Fayette County residents. Yes, 150,000. That's over 53% of those 12 and over who live in our city. We have vaccinated many more who came from other counties and other cities. We've been able to get shots in the arms by engaging a great number of partners. And if we have learned anything during this pandemic, it is how much we need our partners, our collaboration, and of course, Dr. Luke Murray, standing right here, represents Wild Health. Thank you so much for your agreement with the state and Fayette County Public Schools, and to work together. This is how we're getting this done, to administer these vaccines. In addition to the 55 long-term vaccine locations in Fayette County, we have about 10 mobile clinics right now working with our Wild Health partners. And we're also working on a program here to canvass underserved neighborhoods to make sure everybody knows how to get the vaccine and where to get the vaccine, and to get people signed up. Over the past 15 months, I have really enjoyed working with Governor Beshear on ways we can be together to protect our community at state and local levels. He mentioned our phone calls. We regularly talk, because this has been part of getting through COVID, is sharing best practices, talking with the governor about what's next and how we maneuver and negotiate the challenges. So I want to thank you for those opportunities. It's been great partnering that way. And in addition, here in Fayette County, we've had my COVID-19 community stakeholders group as well as my healthcare stakeholder group. We have each met virtually, of course, or by phone once a week since March of 2020. And these folks in our community who have joined these stakeholder groups have been committed to your health and safety, and have shared best practices among physicians, best practices among leaders in our community. I also want to thank Acting Superintendent Marlene Helm for being a wonderful partner. Our Fayette County Public Schools high school vaccine clinics have been so successful. We were out at Dunbar, Paul Lawrence Dunbar together, and I think the number who were vaccinated was around 900 and some, just that one day. So thank you to you, the students, the faculty, the staff. This is the way we get it done. This is the way we move forward for our community. And I want to just say that Lexington loves showing off, of course, and we are so grateful to all of you this last day of school for committing to be here and get your vaccine. It's awesome. And as the governor said, you are helping with our future, with our health. You're helping save lives. Thank you all so much.
You want to introduce Dr. Helm?
And now I'd like to introduce and invite to the podium Dr. Marlene Helm.
Good morning, and thank you. I want to thank Governor Beshear and the mayor. Governor Beshear, thank you so much for your leadership, for your insightfulness to place getting vaccine for educators on a fast track and making it a top priority. It allowed us to work on a return to school plan without having to really worry that our teachers and staff members would be unprotected. So we thank you. We thank Wild Health for their willingness to partner with us, and Mayor Gordon has just been awesome in helping to ensure that we had a partnership that was built on strength and the ability to really build and continue to build so that we are here today. And as she said earlier, back in a couple of weeks ago, I guess 3 weeks ago, we were able to do just a little under 1,000, and today we are approaching 2,000.
Oh, yeah.
So the students and families and staff members that were able to get that first dose 3 weeks ago, we planned it such that they would be able to get the second dose before we left for the summer. And those that are coming today to get their first dose, that's okay. We've still got clinics set up all over, and they'll be able to get their second dose, and really they will look forward to June 11th and be able to have a summer that is as close to pre-COVID, hopefully, as possible. But let me remind you just a little bit about the trip that we've taken down this COVID lane, if you will. We walked out of school on Friday the 13th in March of 2020. That probably should have told us something. It took almost a year. We were just a few weeks shy of 1 full year before we were able to see those big yellow buses back on the road filled with our very deserving and very strong-willed and strong-minded students. And so we do owe a great deal of gratitude to all of our employees, our drivers, our food service workers, our paraprofessionals, our school leaders who had to dig deep. We had them to develop a plan and then a plan and revise the first plan and then redo the second plan, and they just did it and did it over and over again. And our teachers, who had to get real creative real fast. They had to learn a platform that we had really not prepared them for to teach, and they did that. And so I just want to remind everyone that even though we had a very strange year, a very hard year, teachers were teaching, staff was supporting, parents were engaged, and our students were learning. So don't ever think this was a lost year. It was a strange year. It was a year we don't want to repeat, but it was not a lost year. We educated our 42,000 students in a different manner, but we provided education. We distributed over 40,000 Chromebooks, 2,500 hotspots. We provided more than 3 million meals. So our food nutrition folks worked. We made sure that, because for many of our students, school is the very best part of their day. And so we wanted to make sure that they had two very strong meals, and that we did home visits. We did almost 50,000 contacts. So people would go out and help, because we were asking families to help their students learn on a platform that the students didn't totally understand it, and some parents certainly didn't understand it. And so we had staff members that would go out and provide that support. I had a team working with me. A lot of people have said, oh, well, you did a great job. Trust me. Nothing of this magnitude ever gets accomplished by a single individual. This was a team effort at the state level, at the local level, and within our school district, we had a team of administrators. Mr. Jacobs is standing back there. Hats off to him and his team. He had to keep everyone motivated and focused. And I had a team, I called the CCT, the COVID core team, and we met over the winter break. We met, I think we met New Year's Eve, just planning and replanning and replanning. And our district had a lot of other things going on. As you know, in early December of last year, we lost our beloved leader. So we did all of this knowing that he would want us to soldier on. And he thought so highly of all of the educators. He loved the students, and he would be so proud of you stepping up and helping to lead us to the next level. So we have a lot of thanks to go around, and as I said earlier, we did a little under 1,000 a couple of weeks ago, and we're now approaching 2,000. So I think that's a lot to be appreciative of. Let me just give a plug. 3 of our elementary schools this morning presented me with a book called The Pandemic Press, the kids' perspective of the pandemic and what it meant. And if you didn't think that our children were paying attention to both the big things and the little things, read this book. It's available for purchase, and I'll be more than happy to kind of serve as their spokesperson. But it's an amazing look at this past year and how students at 10 and 11 years old perceived and understood what they needed to do, what was happening, and how the future was going to be. They couldn't have done it without their parents. Parents stepped up. Parents stepped up into a role that they never would have imagined that they would have had to step up into. And I think parents and all of us probably have a greater appreciation for teachers now, understanding what they do, the math, the science, and all of that. So let me just end by saying thank you to so many people. And now I'd love to introduce one of those incredible parents who stepped up and had to take on a new role. So Shannon Sampson is the mother of 15-year-old Lauren Clay. Sampson and 13-year-old Ty Sampson both are getting vaccinated today. So Shannon, welcome. Come on up, and I'll turn it over to you.
Thank you, Dr. Helm, Governor Beshear. We actually have a third child, too, who's 10, so I want to give her a shout-out, too, because I'm sure she'll watch this and want to know why her name wasn't mentioned. Her name is Sarah, and she's at Stonewall. Early last week, our oldest, our 15-year-old, woke up with a sore throat, and so I took her to the doctor because we just don't know in these days of what might be going on. And so they tested her for COVID, and we started to think, what if it comes back positive? We have The last days of school, our 10-year-old had already had to be quarantined for a couple of weeks because one of the kids in her class had COVID, and she was so nervous she was going to have to miss these last days of school. It would have meant missing baseball, the last games of baseball this season. It would have meant maybe we couldn't attend the baby shower we were supposed to go to with our children and the graduation parties this weekend. So we just started thinking it's going to really change things. And this has been a frustrating season of so many unknowns. And so our doctor said, you have the opportunity now to get your 12, 13, and 15-year-old children vaccinated. And so we talked to our children. We did think about the risks. I have a lot of friends who are asking, are you going to get your children vaccinated? And we did ask our children what they thought. Actually, I talked to my 15-year-old this morning. I said, what do you think about the vaccine? Do you feel confident? She said, absolutely. This is what we've been waiting for. We're so ready for life to come back to normal. We're so happy that the world is opening back up. But we did talk about the risks. The reality is that there's a risk with every vaccine. There's a risk that when my 15-year-old turns 16, she's going to get behind the wheel of a car. And so we face risks every day. So we talk to the medical professionals that we trust, and we feel very confident with our decision. So this is our family decision. We feel like this is our civic opportunity as a family. It also protects us as a family. So we are excited to be able to do this, and our 10-year-old, when she is old enough, I'm sure will want to do the vaccine as well.
I'm with you.
We are thankful for our leaders. This has been, we don't envy at all the role that leaders have had to take on. So many unknowns again. My husband's connected to healthcare, and just watching daily so many changes. It's been our honor to pray for you all, to cheer for you. We know it's been hard, and we are so thankful. And to our teachers, man, we're so thankful that our children were able to come back to school. My youngest came home on the first day back and said, I met a friend. I said, well, you've had her in your class the whole time. And she said, I know, but I've never really talked to her. And so being in person brings so much joy back to education. So thank you all for making that happen this year. And we are excited for hopefully a big return to normal. So thank you, Mr. Jacobs. Thank you, Jesse Clark teachers and Stonewall teachers. You all have been phenomenal. We know it was difficult. I'm an educator as well, and we know you all did a lot to bring these kids back. So thank you. And thank you all for this opportunity today.
All right.
All right, y'all have been really patient. You ready? All right, let's get some people vaccinated.
Just so I can take a search for him.
Don't worry, I'm not going to do it.
Kirsten, get in the picture. Thank you.
You nervous or you all good? All good? Just a shot, right? y'all.